This is the most interesting presentation, and this is a 33-year-old woman who works as a physical therapy assistant and was in a motor vehicle accident in 2006 and has had a couple of MRIs, x-rays of cervical spine, pelvic MRI, and describes a difficult process of trying to get appropriate care for the injury. And she did find a chiropractor in Pennsylvania who put a sacroiliac belt on her, which immediately gave her some benefit. Her pain involves right sciatica and pain along the posterior flank and buttock, lumbosacral SI area, and it wraps around to the anterior abdominal and chest wall. What's surprising to me is that her body type is that of a person who should be very flexible throughout. And I'm going to show you that she in fact is very flexible in her hands and elbow. She has good shoulder mobility. She has very good hip flexion. And is pretty free in hip rotation but lacks extension on both sides, which is surprising. And her ankles are very restricted, but there's this remarkable rigidity all the way up her spine. And we're going to find out if we can change that. So this will be a rather brief film. I'm going to go through it rather quickly. So let's now demonstrate her hand. And so she's somewhat tall, and I'll bet you don't weigh anything over 125, 30, nothing beyond that. Yeah, 115. And you're how tall?
5'4".
Okay. So she's a slender woman, and you can see that she extends the fifth MP at least to 90 degrees. And so this would predict a rather mobile body throughout. She has a little bit of a lack of supination on this side. She's quite tender in that joint, so we'll pay attention to that later on. But this represents the kind of flexibility I would have expected from her. Let's have you lie on your back now. I'm going to look up. So lay looking up, please. Roll over. Her ankles only dorsiflex to neutral. She has remarkable restriction of the subtalar joint, and that pattern is repeated on the other side. If I just try and induce a little bit of force through this, which should create some movement in her knees, this just feels like a log. It doesn't feel like deformable tissue. I mean, your muscles are very tight, you know that, right?
Mm-hmm. Don't let the dog see you.
And there is no spring through the mid part of her femur. There's no mobility through the pelvis in any direction. I can't even take up the slack. There's no lateral mobility. There's no inferior mobility. Okay? Can you lie on your stomach, please? She has sufficient rotation in supine, and this is a different context, and she has, you know, a reasonable amount of hip rotation, but extension is 5 degrees on the left. I would expect her norm to be 20 degrees and maybe even more, and on the right, there is no extension of the hip. If I try and push on her sacrum, nothing happens. I try to push on the top of the ilium above the PSIS. There's no give whatsoever. There's just no movement. There's no force transmission with reasonable amount of forces that would create movement, force transmission through a person with this body structure. Okay? Now the sacrotuberous ligaments are right here, and they're in a location where there is no bone. I'll bring a pelvic model. Yet her sacrotuberous ligaments feel like bone. They're extremely rigid. They're right here. Okay, there's no bone in there. Extremely rigid, and that's the story for the rest of her spine. I'm just not able to take up any slack, and this is a remarkable finding. And when she lays on her back, her neck is in hyperextension, and when I try and do traction, there's no give. When I try and lift her head up, it's very difficult to lift for the simple fact that she's in hyperextension. So the first joint is not going to move readily. So it would take much more force than is normative to be able to lift her head up, and it would lift at the C3 junction and down. So I'm going to stop right here other than showing her gait. So we're going to keep filming, and let's have you come out here and walk, please. You can take over. So just go back about halfway, please. Good, turn around and come back. And then go again. You can see there's just no transverse plane mobility in the pelvis. There's a side-to-side give, which I presume to come from the hip joints. And there is some arm swing, but you'll notice that actually there's no shoulder girdle mobility other than arm swing coming from the glenohumeral and coming from the elbow joint as well. This is a rigid body. This structure is very rigid, and she's aware of the fact that the right hip doesn't extend much, and in fact it induces pain when she tries to extend that. Can you roll your pants legs up and come one more time, and then I'll stop filming? I know we're at 7 minutes already. Can you roll your pants legs up a little bit, please? And I think you'll be able to see that there's just no very minimal subtalar mobility. You just don't see any transverse plane mobility in the lower extremities. And again, we showed that ankle dorsiflexion is only to 90, and you can see she has considerable difficulty just lifting her feet up. So I'm going to stop here. We're at 7 minutes, 10 seconds, and we'll treat her, and we'll come back and show another film in about an hour.